Michael Balint's quotes and psychological insights. 1. The doctor is the drug. Balint famously highlighted the importance of the doctor-patient relationship, suggesting that the doctor's attitude, empathy, and communication style can be as healing as the medicine they prescribe. The relationship itself plays a crucial therapeutic role. 2. At the bottom of many human problems lies the basic fault, a gap or crack in early relationships. Balint introduced the concept of the basic fault, which represents a deep, early developmental rupture in the relationship with primary caregivers. This gap leads to a sense of incompleteness or vulnerability in adulthood, influencing relationships and emotional health. 3. The task of therapy is to explore the patient's past relationships and how they repeat themselves in the present. Balint focused on how early relational patterns repeat in adulthood, especially in therapeutic relationships. Therapy involves understanding and addressing these patterns to heal unresolved emotional issues. 4. What the patient brings to the consultation is not only symptoms, but also a need for understanding, attention, and recognition. In his work with doctors, Balint emphasized that patients often seek not just treatment for their physical symptoms, but also emotional support and acknowledgement. The emotional aspect of medical care is key to healing. 5. In the doctor-patient relationship, both bring their own unconscious material into the encounter. Balint pointed out that when a doctor and patient interact, both of them bring hidden feelings, attitudes, or past experiences into the relationship, even if they're not fully aware of it. These unconscious influences can affect how they communicate and how the treatment unfolds. For example, a patient might project trust or distrust onto the doctor based on past experiences, transference, and the doctor might unconsciously respond in ways shaped by their own emotions or background, countertransference. Understanding this dynamic can help make the relationship more effective and supportive. 6. For some patients, the gap between what they need and what the world can offer is unbridgeable. Balint noted that for some people, the basic fault creates a chronic sense of dissatisfaction, where no relationship or external situation can fully meet their emotional needs. Therapy aims to help patients manage and understand this gap. 7. Doctors often face the challenge of patients who present with symptoms that have no clear physical cause. These symptoms are often a cry for emotional attention. Balint explored how psychosomatic symptoms, physical symptoms with no apparent medical explanation, often reflect underlying emotional distress. Doctors need to look beyond the physical to understand the emotional causes. 8. The ultimate task of therapy is to help the patient accept their dependence while also finding ways to tolerate it and transform it into something constructive. Balint believed that dependence on caregivers is a natural part of human development, and therapy often involves helping patients come to terms with their dependence needs in a healthy, balanced way. 9. Many therapeutic failures occur because the emotional needs of the patient are not understood or are disregarded by the doctor. Balint warned that doctors and therapists who focus only on symptoms or technical aspects of treatment can miss the emotional needs of their patients, leading to ineffective therapy or treatment outcomes. 10. In the analytic setting, the therapist becomes a representative of past figures in the patient's life, allowing old wounds to be reopened and healed. In therapy, the patient often unconsciously sees the therapist as a stand-in for important people from their past, like a parent or caregiver. This dynamic transference helps bring up unresolved feelings or hurts from those earlier relationships. By working through these emotions in a safe and supportive environment, the patient can start to heal and move forward in healthier ways. Psychological insights. 1. The basic fault. One of Balint's key contributions is the concept of the basic fault, which represents an early developmental rupture between the child and their caregiver. This rupture creates a deep emotional wound that the person carries into adulthood, often manifesting as feelings of emptiness, dissatisfaction, or a sense that something is missing in their life. The basic fault is central to understanding chronic emotional difficulties and relationship problems. 2. Doctor-patient relationship. Balint's work in medical psychology emphasized the importance of the doctor-patient relationship in healing. He believed that the doctor's ability to provide empathy, understanding, and emotional support is just as important as their technical skills. The doctor, in many ways, becomes a therapeutic agent in the healing process, often acting as an emotional caregiver for the patient. 3. Balint groups. Balint is also known for creating Balint groups, which are groups of doctors who meet to discuss their emotional experiences with patients. These groups help doctors become more aware of the emotional dynamics in their interactions with patients and improve their ability to manage transference, a phenomenon that occurs when a patient unconsciously redirects their feelings or desires onto the doctor. And countertransference, a phenomenon that occurs when the doctor may unconsciously respond in ways shaped by their own emotions or background in medical settings. These groups focus on understanding the emotional needs of both doctors and patients, helping doctors avoid burnout and improve patient care. 4. Transference and countertransference in medical practice. Balint extended the concepts of transference and countertransference, originally used in psychoanalysis, to the doctor-patient relationship. He believed that both doctors and patients bring their unconscious material into the medical encounter, and understanding this dynamic can improve the therapeutic effectiveness of the relationship. Doctors often take on the role of past caregivers for their patients, and being aware of this can help them navigate the emotional complexities of patient care. 5. Psychosomatic symptoms. Balint explored the phenomenon of psychosomatic symptoms, where patients present with physical complaints that do not have a clear medical cause. He argued that these symptoms often reflect emotional or psychological issues, particularly unresolved conflicts or unmet needs from early life. Understanding the emotional roots of these symptoms is essential for effective treatment. 6. Dependency and therapy. Balint emphasized that dependency is a normal and necessary part of human development. Many psychological problems arise when people are unable to accept or manage their dependency needs, often because these needs were not adequately met in childhood. Therapy helps patients acknowledge and work through these dependency issues, allowing them to develop healthier relationships. 7. Emotional needs in therapy. Balint's work focused on how patients often come to therapy or medical consultations with unspoken emotional needs. These needs may not be immediately apparent, but they can be just as important as the symptoms they present. He believed that effective therapy or medical treatment involves addressing the whole person, not just their physical or emotional symptoms. 8. The emotional gap. Balint explored the concept of an emotional gap that exists for people with unresolved childhood traumas or unmet emotional needs. This gap can be felt as a persistent sense of something missing, and no external relationship or success can fill it. Therapy aims to help individuals understand and manage this gap, rather than expecting external solutions to fix it. 9. Therapeutic failures and emotional neglect. Balint observed that many therapeutic failures occur when the emotional dimension of the patient's needs is overlooked. He stressed that doctors and therapists need to be attuned to the emotional dynamics of their relationships with patients to avoid neglecting important psychological factors that contribute to healing. 10. Repetition in therapy. Balint noted that patients often unconsciously repeat patterns from their early relationships in the therapeutic setting. The therapist becomes a stand-in for earlier caregivers, and through this transference, old wounds are reactivated. However, this repetition also offers an opportunity for healing, as the therapist can help the patient work through these unresolved conflicts in a supportive environment. Michael Balint's work on object relations, the basic fault, and the importance of the doctor-patient relationship has had a lasting impact on both psychoanalysis and medical practice. His insights into the emotional needs of patients, the dynamics of transference and countertransference, and the role of early relational patterns continue to influence therapeutic approaches in both psychological and medical settings.